Fish know this, and when they get sick, they rise to a warmer climb. That raises their temperature, and then they go back to the cooler climb once their infection's over. Here's the same experiment they did with the lizards. If the fish were allowed to go to a warmer climb up to 32.7 degrees Celsius, which is a fever for a fish, okay, they all survived. But the cooler you kept them, the lower the survival rate. Now, these are reptiles. What about mammals? Does this work with mammals? And again, there's a lot of evidence. I'll just show you a couple of the more important ones. Herpes canine virus. In a normal dog, if a herpes canine virus, they get it, they'll get a little runny nose, and they ignore it. But for newborn puppies, if they don't get their mother's maternal antigens from the milk, if they get it, they die if they're less than 2 weeks old. If they're over 2 weeks old, they get a little runny nose, they ignore it. Now, what's the difference? Well, at 2 weeks old, they can regulate their temperature, they can mount fevers. Newborn puppies don't have that temperature regulation capability yet. And so it was thought that this was what was making them susceptible to herpes canine virus. So they took a bunch of puppies, and newborn puppies didn't let them have the mother's milk, and they infected them all with herpes canine virus. Half of them they kept, at room temperature. The others they incubated with temperatures up to 101.5 to 103 degrees Fahrenheit. They induced a fever in those. By day 9, all the unincubated puppies were dead. By day 9, all the incubated puppies were still alive. One died a day later, but the rest all survived. And this was, again, a few degrees Fahrenheit made the difference between life and death in mammals. Amazing. When they did pathology studies on the animals that died, the unincubated puppies showed disseminated focal necrosis. Little areas of tissue died from this infection with this virus. And that was in the brain and in the lungs. But the puppies that were incubated, they would see a little area of necrosis, but it would be walled off immediately with fibrous tissue, isolated, and that's what allowed them to survive. They actually sacrificed one so they could look at it pathologically, and that's what they saw. The immune system was taking care of it as long as it had the higher temperature. So what is a fever? In other words, where does it come from? Why do we get one? By the way, this is another case for benefits of a fever. As a creationist, I say that, I believe that if we have a system designed into us, that it's put there by a loving creator, and it's put there for a beneficial reason. It's not put there to make our lives miserable. And there is such a fever, there's such a mechanism to produce a fever in humans, and because of that, I believe that it's there for a reason, a good reason. This is how it works. When you get infected with the bacteria goes in the blood, stimulates a white cell. White cell says, hey, we got some invaders here, we better do something. So it releases interleukin-1, it's a molecule, which stimulates the release of prostaglandin E1 and E2, which goes across the blood-brain barrier. And in the brain, it resets your thermostat. From 98.6, it goes up to, say, 102. Now, when your thermostat is 102, but your temperature is only 98.6, are you going to feel cold or hot? Actually, you're going to feel cold because your temperature is now below your thermostat set point. Thermostat set at 102, but you're only 98. So you say, I feel cold. You put on a blanket, you start to shake to generate heat, and that brings your temperature up to 102. Now you feel comfortable because your temperature has matched your thermostat. Does that make sense? But someone coming up to you and touching you says, you're burning up. Don't you feel hot? And you say, well, actually, no. Now, you will feel exhausted because maintaining that high temperature taxes your metabolism. It's very difficult. It takes work to keep that temperature up. But now, you keep warm, you're shaking, you keep that temperature up, and that turns on your immune system, Now you clear your infection. Once your infection's clear, your body resets its thermostat down to 98.6. But you're still at 102. So now do you feel hot or cold? What do you think? You feel hot because your temperature is exceeding your thermostat. So you feel hot, you throw off the blankets, you break out into sweat, and this brings your temperature back to 98.6. And that's the normal cycle. That's what you're designed to do. That's how you're supposed to fight infections. That's what was happening with these lizards and puppies and all. So fever stimulates the immune system. How so? Well, these are just a few of the ways that fevers work. Fevers are like a conductor in an orchestra. When the conductor, he starts directing different instruments and they play in unison. Fever directs several different mechanisms to turn on and to rev up in intensity. One of them is the T lymphocyte. T lymphocytes have antiviral and anti-tumor properties. They can help you fight tumors. When infection occurs, fevers work to enhance the T lymphocyte activation and proliferation. In other words, when you've got a fever, when your temperature goes from 98.6 to 102, you are producing T cells 20 times faster than you are when your temperature is 98.6. So it turns on the T cell production and it stimulates their activation. They are now more active. Interferon is another chemical released into the bloodstream, and it has antiviral, anti-tumor, and antibacterial actions. And when the temperature goes from 102 to 104, interferon becomes more than 3 times as effective in fighting viruses in a tissue culture. Also, fevers dramatically increase interferon production when it is stimulated by the presence of a virus. Okay, what is this? This is the red are anthrax bacteria. These are the bacteria. The yellow is a white cell engulfing the anthrax. That's phagocytosis. Phagocytosis increases at higher temperatures. The white cell mobility increases markedly when you go from 95 to 104. So the white cells move faster, they gobble up bacteria faster, and they actually destroy the bacteria once they're gobbled up better at the higher temperatures. Another thing fever does is it lowers your free iron in your blood. It starts storing it to where it's unavailable bacteria, because the bacteria need the free iron, and so the fever actually suppresses your free iron in your blood, so the bacteria don't have it available. We have something in medicine called the anemia of chronic disease, and it's kind of controversial as to why it's there. If you have a chronic inflammation, you can have a relatively low iron level, and but it's when we understand what fevers do, it's actually designed to do that. There's actually a beneficial effect of having that suppressed free iron. Okay, are fevers beneficial in, they're beneficial in bacterial and viral infections. What about cancers? Fever therapy has had some success as anti-tumor agent, according to articles, there's a whole host of articles. William Cooley was one of the first to observe the benefits of a fever in a cancer patient. He was actually an orthopedic surgeon in Memorial Sloan Kettering Cancer Center from 1890 to 1936, and he's considered the father of modern immunotherapy. Early in his career, Cooley witnessed the spontaneous remission of a large lymphosarcoma of the head and neck. It's a cancer in the head and neck, when the patient got another infection from a streptococcal infection. He got a bacterial infection. The body's immune system turned itself on to fight the infection. But guess what? The cancer went away as well. The cancer went away because the immune system was turned on by stimulus from this strep infection. So Cooley started making he would get strep pyogenes and get the toxin from it. He would inactivate it and inject it into patients and produce fevers that way. The body would say, "Oh, we're being invaded." It would turn on the immune system and help fight cancers. He was getting a 10% remission, a cure rate of about 10%, which was unsurpassed at that time in the treatment of advanced cancers. By the way, I did talk to a surgeon in Oklahoma who does breast cancer surgeries, and he actually said, interestingly enough, when they remove a cancer from a breast, if the patient gets a post-operative infection, they actually have a better survival than if they don't. I said, now, don't let them get infections. That's considered malpractice. But he said, if they do, they do better. 1934 to 1935, Engel observed that, like I said, individuals who had never experienced febrile infection diseases were 2.5 to 46 times more likely to develop cancer than those who had febrile infections growing up. In other words, as you're growing up, the thought is that just like a muscle needs exercise, your immune system needs exercise. And if you get the exercise of having fevers and developing that part of your immune system, that if you get cancers, your immune system, you can get a low-grade fever, which you may not even notice, which can help fight cancers and help prevent development of cancers.
Dr. Emerson,
Yeah.
is that why people can get night sweats when night sweats are a sign of cancer?
Night sweats can be a sign of cancer. We had when you get a cancer, ideally your body wants to recognize it and turn on your immune system. But this doesn't always happen. But when it does, it's a helpful clue. We had a patient who had came in complaining of night sweats, and I said, well, we'll look for an infectious source. We did cultures and all, and he didn't have an infection. Then we looked at autoimmune, so we did some of the regular autoimmune tests, and he didn't have any of those. So I said, well, now we need to look for cancer. So we did CAT scan of the head, neck, the chest, the abdomen, and he had a kidney cancer. And they caught it early, they took it out, and he did really well. But the only sign he had was the night sweats, that fever and then chills. They have done studies on spontaneous remission of cancers, and they have found that when a cancer just happens to go away, they don't understand why it goes away, that in over 22% of the leukemic patients, it was following a fever. Over 15% of the bone and connective tissue remissions were followed by fevers. That many of these remissions are followed by a fever, indicating that the fever may have had something to do with it. Is hyperthermia being used today? Dr. Mark Drewhurst at Duke University, they are using local heat as an addendum to chemotherapy to increase the remission rate. It stimulates the immune system, and they have gotten improved responses when they add it to either radiation or chemotherapy. In Germany, they're using this much more. We don't hear about this much in the United States. The only thing we hear about in Germany, in the United States, is when they add it to chemotherapy. And how do they do that? They put you through an MRI. They localize the tumor. They find out where the tumor is, and then they focus microwaves on that tumor. They heat it up locally. The MRI can actually tell you how high you are heating the tumor with. And when they do that, it doubles the survival rate. It's a major improvement in survival. In cancers in China, they are looking at in China, 60 patients with non-small cell lung cancers. When they add hyperthermia to the chemotherapy, remission rates go from 37 to 63%. They double it. Same with head and neck cancers. It doubles the survival and improves 5-year survival from 0% to 53%. And pancreatic cancers, same. There was a whole list of cancers. I just didn't have time to do it. They're doing whole body hyperthermia in addition to chemotherapy in University of Texas. It's a research hospital. They sedate them with anesthesia and heat them up. Here in Germany, however, they're doing stand-alone hyperthermia without chemotherapy. They could do that out there. And this is the treatment box they use. They go in there, they use infrared lights, and that heats them up. Once they get to high temperature, they turn off the lights, put blankets on, keep them warm. This thing costs about $20,000. You don't need a $20,000 machine to give your fever treatments. And I guess you're going to show them how to do that, fever treatments, today or somehow. Anyway, we'll show you how to do fever treatments at home in a bathtub with hot water. And you can bring the temperature up to about 102. When you get to 102, you can bring them out of the tub, wrap them in a wet sheet, put blankets on them, keep them hot. You try to keep them hot, 102 or greater, for about an hour. They can lie in bed and comfortable. And at that, when you do that, you can turn on your immune system. And in that setting, that's what my wife did. And it helped her dramatically. In that setting, you can turn on the immune system. You can use it for something as simple as a cold, or you can help treat cancers with that. Any questions? All righty, thank you.